All right, so good afternoon again. I'm Marie O'Neill, and I am very happy to introduce this webinar, which is one in a series that we are sponsoring through our National Institute for Environmental Health Sciences funded center, the Michigan Life Stage Environmental Exposures and Disease Center, or M-LEEaD. And this is a collaborative effort between our Community Engagement Corps, our Stakeholder Advocacy Board, which consists of members from community in Detroit and Michigan at large, and the Integrated Health Sciences Corps. Next slide, please. And I want to start out by acknowledging that the University of Michigan is on land that was originally the land of the Anishinaabe, the Three Fires Confederacy of the Ojibwe, Odawa, and Potawatomi, along with their neighbors, the Seneca, Delaware, Shawnee, and Wyandot nations, who cared for and lived on the land from which we are presenting for many generations. We acknowledge, renew, and affirm the ancestral and contemporary ties of the Anishinaabe to this land and are grateful to the opportunity afforded us to present from this land. Next slide, please. So today's seminar features my colleagues and collaborators, Zachary Rowe and Carina Gronlund. Zachary is the executive director of Friends of Parkside, a nonprofit that represents residents of the villages of Parkside in the east side of Detroit, and Carina Gronlund, who is an assistant research professor at the Institute for Social Research here at the University of Michigan. So with that, I will turn it over to Carina and look forward to hearing from Carina and Zachary. I will also mention that folks can put questions in the Q&A or in the chat, and we will have time for question and answer after the conclusion of the presentation. Thank you. Carina?
Yeah, I think that's actually me.
Zachary, then, please.
Okay.
I've got it as me, Zachary.
Okay, alrighty, please.
Well, good afternoon, everyone. It's just barely afternoon, and happy Tuesday. I want to start out by explaining how this CHHH partnership got started. CHHH, of course, is the Climate Hazards Housing and Health Community Academic Partnership. And it all started back in 2016, I think it was. Marie was contacted by a urban planner from Georgia Tech named Brian Stone. And he invited Marie to participate on a grant submission to this mechanism from the National Science Foundation, the Hazard Seas mechanism. And that proposal was entitled Enhancing Emergency Preparedness for Critical Infrastructure Failure During Extreme Events. So to holistically consider the health consequences of a blackout or electrical grid failure that would occur at the same time as a heat wave in 3 cities, Detroit, Phoenix, and Atlanta. And this was a big project. There were energy grid experts who were simulating blackouts, modeling blackouts and how they would affect different parts of the city, when they would occur in different parts of the city. There were climatologists who were simulating what the future climate would be like in 2040 and then at the end of the century. And they also created some really spatially resolved climate projections. There were also social scientists, and Marie and I and collaborators from Arizona State University were the epidemiologists involved in the project. And we assessed individually experienced temperatures, or were charged with doing that, and what the health impacts would be from this simultaneous blackout and heat wave event where people's indoor temperatures and hence the temperatures that they individually experienced would go up pretty dramatically. One component of this involved surveying residents in each of these 3 cities and asking them to wear eye buttons to measure individually experienced temperature, and also to have indoor temperature monitors in their homes. And when the project was awarded, Marie felt very strongly that this was something that we needed community partners for. Next slide. So Larissa Larson, who's an urban planner here at the University of Michigan, and Marie, and I was a postdoc at the time, so I helped with this a little bit. We thought about what community organizations in Detroit would be able to help us with this, and also who we already had existing connections with. So Marie knew Detroiters Working for Environmental Justice, Executive Director Guy Williams, and then also Zachary from her role on the Detroit URC. I had an existing relationship with Jefferson East, which is a not-for-profit on the Lower East Side of Detroit that they do a lot of things now, but right now they also do housing interventions and clean and safe interventions on that side of the city. And then Southwest Detroit Environmental Vision was an organization that Larissa had connections to, and they tackle environmental justice issues in Southwest Detroit. And Larissa also had a connection to EcoWorks, which, like Detroiters Working for Environmental Justice, is a citywide organization that addresses environmental issues. Next slide. I'm going to let Zachary describe Parkside in a little bit more detail.
Okay, thank you, Carina. So basically, if I may, I just want to maybe sort of go back just a little bit, just to set the context, or just to set the stage for what I'm going to be sort of saying in the next couple of slides. So basically, Carina and I are going to be talking about, our experience with the climate hazards, housing and health community academic partnership. And so basically, we're going to be sharing the good, the bad, the ugly, and we still don't know yet. So just to give you an idea of what to expect from us, right? And then also, I think Carina hit up on a couple important points just a few minutes ago when she talked about the initial project that led us to this partnership. I'm not sure if you were listening, you should have heard when she talked about folks from University of Michigan going to be coming to Detroit, knocking on people's doors to get them to wear eye buttons, have an indoor temperature device in their house, and to have this thing in their yard called a hobo. I still don't know where they got that name from, but it's called a hobo, right? And to Marie's credit, and Carina did say this, to Marie's credit, I think she realized that probably wasn't a good idea. And so that sort of brings us to this thing called CBPR, or community-based participatory research, right? It's a certain way of doing research. It's different from traditional research. Traditional research means that the PI sort of make all the decisions for the project. When you talk about community-based participatory research, or CBPR, what you're talking about is partnering with community partners as equal partners around the research. And these are some of the selected principles. There are half a dozen or more principles, depending on what partnership you're working with. But the one that was important for our partnership, we included it here. So equal partnership between community and academic partners. And so that means that we were, basically equal partners. We all had an equal say in how the project moved forward. And for a PI, if you're a principal investigator, that means that you have to be willing to give up some control and some power. And for some, that's really difficult. For others, not so difficult. Also, one of the key principles of CBPR is assessing the community's strength and dynamics. For the most part, you can go to any community in Detroit or any community, in any state or country, and what you will realize is that there's some strength in that community. You just have to be smart enough to find out what those strengths are, right? And not assume that there's nothing positive, nothing sort of happening in that community. Another principle has to do with identifying priority around public health issues and research questions. Also, designing and conducting ecological intervention and policy research. Another important principle is providing feedback and interpreting research findings. We're going to get into a lot of these, in a minute in terms of how we did it with our partnership, and disseminating and translating research findings into intervention and policy. One of the things I always say when I do presentations that community is not interested in research for the sake of research. We're only interested in research to the extent it helps us to solve problems. Okay, next slide. Okay, I guess I think. Thank you. So one of the groups that's been doing this work for more than 25 years is the Detroit Urban Academic Research Center, and if you can imagine, that's a mouthful. So we just call it the Detroit URC. The Detroit URC is celebrating our 27th year as a community-based participatory research partnership made up of 8 community-based organizations, Henry Ford Health Systems, the Health Department, and the U of M Schools of Public Health, Social Work, and Nursing. The overarching goal of the center is to foster, enhance the capacity of, and sustain collaborative community-based participatory research partnership between academic institutions and Detroit-based organization whose work focuses on understanding and addressing the social and physical environmental determinants of health to promote health equity. That's a mouthful, but that's what we do. All right. Okay, next slide, please. Okay, this point I'm going to just maybe talk a little bit about the project. And I sort of talked a little bit about it, but the important thing about this project is that when it initially started, it was a traditional research project. One of the things that we did with this project is try to figure out how can we transition the project from a community place to a community-based project whereby a community had some say in terms of what the research sort of looked like, right? And so a couple of things that we did in order to sort of make that happen is that we developed partnership protocol and operating norms, which included consensus-based decision-making process, which we call our 70% rule. The tricky thing about the 70% rule is that it's not 70% of the people, but 70% of can you get behind it in your mind, right? So in your mind, can you get 70% behind that ideal, right? If you can, then the decision go forward. But if not, the group continue to sort of talk until you reach the 70%, right? Our community partners in Flint call it something else. They call it the can you live with it rule. But it was important that we have this particular decision-making model, because sometimes if you look at the majority, if you go with the majority, then that means the minority of folks are unhappy. And so this way, we try to make sure that everybody is comfortable and they can live with whatever decisions being made by the group. Also, we had to have clearly defined roles for the CBOs and the academic partners. Also, we used this as an opportunity to build the capacity of our community and academic partners. There was co-learning on both sides. Also, we had a data sharing agreement, which is crucial in terms of how the data will be shared. Right. Also, we developed scopes of services. We also instituted a communication and dissemination results as part of our standing meeting agenda item. One of the things we wanted to make sure is that, as we were learning things, we wanted to make sure that it was captured and shared, with community as well as with the larger academic community. And we're going to hopefully have a chance to talk a little bit more about that. And then we evaluated the extent to which there was shared power in communications to improve the partnership. So we did a partnership evaluation that let us know as a partnership how well we were doing, right? Which is different from doing a project evaluation. And then also we co-analyze the data. So I told you that we were going to talk about the good, the bad, the ugly, and what we still don't know. So you talk to some of our research partners, this may be either the ugly or what didn't work. It was this thing called the time activity diary. And so the idea behind the time activity diary, it was to sort of capture what residents or what participants were doing at a certain part of the day, right? So if you can imagine looking at your 24-hour day and just trying to remember or trying to write down what you did from the time you got up to the time you went to bed, that's a major task, especially if you weren't sort of used to taking the time to document or journal what you did, right? And so one of the things that we realized that this was not really that helpful for our particular project. In the future, maybe, but yeah, it didn't really work out that well, right? So if we have any researchers who are interested in doing a time activity diary, you might want to rethink that. So at this point,
yeah, I'm sorry, go ahead, Zachary.
No, I said at this point, I just want to turn it over to Carina to talk about what did work.
Yeah, well, let me just pause on the time activity diaries first. I think we missed a really great opportunity actually to improve upon these because we really kind of rushed given the constraints by the Arizona and Atlanta sites. And this was even a simplified version of what we had originally set out to do, but it was still too complicated. So like Zachary said, if you want to do time activity diaries in your project, it's useful to talk to community partners who have a better feel for what's going to be realistic on the project. Next slide. Now, one thing that really did work from our partnership was that, the data shows that we did manage to reach vulnerable groups, which is important when doing research on climate justice, because there's lots of literature showing that climate vulnerability is greatest among people of color and in low-income households in the US. Now, I just want to point out that the Detroit arm of this project had adopted this community-based participatory research approach, and I give the Georgia Tech and Arizona State PIs credit for being really supportive of this, but they did not adopt a CVPR approach in their sites. So the Arizona State University group in surveying the Phoenix participants did kind of a more classic door-to-door survey approach. And then in Atlanta, it was more kind of a snowball sampling approach where the team was kind of seeking out participants based on what other participants recommended in terms of people to participate. So in our approach, we did reach a larger percent of Black or African American or Hispanic or Latino households. And then I also have here the census statistics for this region, just to give you a sense of how our study population basically matches or is very close to the demographic distribution in the city of Detroit. Most of our participants were also low income in that they had household incomes of less than $40,000 a year. Next slide. Another thing that worked was the indoor temperature measurements. So we put up these devices called hobos. Like Zachary said, it's not really clear why they have that acronym, but they're commonly used indoor and outdoor temperature measuring devices made by Onset. And our hypothesis was that indoor temperatures were often uncomfortably high in many of our participants' homes, and that was really borne out by the measurements. And this is data from 45 households during the 2016 summer study period. And we saw that at 5 o'clock in the morning, which is what these temperatures are here, when people are usually trying to sleep, 71% of our households at some point in this time period had temperatures inside their homes at 5 a.m. that were above 82 degrees Fahrenheit. So those are pretty uncomfortable sleeping conditions. And just as kind of a benchmark, 30 degrees Celsius here on the y-axis is 86 degrees Fahrenheit. So you did have some homes that were even warmer at this time of day. Next slide.
So another thing that did work was this form that we call the individual climate report. One of the things that I mentioned earlier is that with CBPR, one of the goals is to provide results to folks who participate in the study. And so this was our way of providing feedback to folks who participated in the study. And we try to make that information based on that individual. So if you spend a few minutes just sort of glancing at some of the columns, it talked about with the eye button that folks had to sort of wear. It sort of captured their temperature. Also, since we had an indoor monitoring device, it also captured the temperature that was in the house. And Carina just sort of shared a little bit of that. But and outside with the hobos, it also shared the what was the outdoor temperature. And so basically, for folks who felt like it was really hot at certain days and times, the individual climate report actually confirmed what they felt, that it was really, hot, more warm inside than outside kind of thing. And we shared this with the individual, and they really gave us first of all, they were really appreciative of getting this information. And two, they did give us some great information, great feedback about this individual climate report. I think the biggest feedback they gave us was that it would have been really helpful if they got it sooner, because I think they got it months later, but that's one of the challenges of research, right? Next slide, and this is back to you, Carina.
Yeah, so there's this really complex, messy flow chart called a directed acyclic graph. The epidemiologists in the audience will recognize it. So community partners in CBPR participate in grant writing, they participate in recruitment and retention, they participate in manuscript preparation and other dissemination. I mean, they are your co-investigators, which is what I tell academics. Think of them as your co-investigators because they are. But in reality, academic partners often do all of the actual data analysis, and they disappear for a few months, hopefully not a few years, and come back with the results. So we wanted to figure out a way to bring community partners into the analysis phase of the research. Now, like I said, the epidemiologists will recognize this because a directed acyclic graph is a really commonly used way to figure out what confounders you need to include in your models when you are analyzing the association between some exposure and some health outcome. These decisions are, when you're thinking about what could bias that analysis, they're often based on a priori knowledge that you have from the literature or personal experiences about what these potential biases might be. Well, when you're leaning on personal experiences, who better to help you make these decisions than community partners? Now, in this super messy diagram, we were looking for actually a couple things, how air conditioning use was associated with heat-related illness, but also how health status was related to heat-related illness in our study population. And this information was obtained from surveys of the participants, but also contextual information based on their residential addresses. I just want to draw your attention actually to the variables that are in the solid boxes, the boxes that is with the solid lines. And these were variables that our community partners encouraged us to add to our model, or that we had some really great discussions about in terms of what the underlying mechanisms for these sources of bias might be. And they, really emphasized how indoor housing features might really be influencing our results and the importance of capturing that in our regression model somehow. Neighborhood safety was also something we talked about. So forgot to mention that a lot of our participants don't have air conditioning. That's why we're getting indoor temperatures of 82 Fahrenheit or higher, sometimes at 5 o'clock in the morning. But in some neighborhoods, people are uncomfortable with opening their windows. So you're getting indoor temperatures that are even higher than outdoor temperatures. Next slide.
So one of the things that came out of the initial project that the community partners work with the researchers on was this thing called Dcrew Art, the Detroit Communities Reducing Energy and Water. One of the commitments that Marie and the other researchers made to the community partners is that based on the results of the initial finding, that they would be willing to look at intervention kinds of things, because the initial project that we sort of talked about and that Carina talked about was one of those traditional research projects that really didn't have any intervention other than going out, sort of getting the data, and that's it, right? If you recall earlier, one of the things I said, I'm gonna probably repeat this 2 more times, is that community is not interested in research for research's sake. We're only interested in research to the degree that it helps us to solve problems, right? And so the information that was generated from the initial project began to sort of point out issues that we could work on. One had to do with, sort of energy and water use. And so we worked with the researchers and we came up with this project called Dcrew, right? Kind of a cool name when you think about it, right? Detroit Crew, okay, all right. So the purpose of the project was to sort of focus on reducing barriers to assistance program among low-income Detroit residents. Also, it had this individual case management approach. It supported assessing energy and water assistance program, and we're going to talk a little bit more about this during the presentation. Also, efficiency and conservation education and tools, working with one of our partners, EcoWorks. Assessing of high or low indoor temperature in the summer and fall influence cognitive function and sleep quality. Carina is going to talk more about that. And then understanding the health benefits of energy efficiency upgrades, right? Next slide, please. So this is a Dcrew project timeline. It sort of breaks out some of the major activity that was happening during the course of the project. We had group meetings where we did some discussion around weatherization and some other things. And then we had some follow-up that was done by the case manager. Then we had some individual meetings. The important thing is that little funny little gray little thingy thing. So if you were alive in April 20, then you sort of realize what that kind of represented, right? And that's sort of the COVID, right? Where everything pretty much shut down, right? And so we had to use that to pivot in terms of how we were going to finish the project. And we're going to talk more about that when we get to that slide, okay? So at this point, I think I hand it back to Carina. So next slide, and Carina, you're next.
Thanks, Zachary. So before starting the intervention on the participants, which included a sustainability case manager that was going to come to their home and help identify programs that they might be eligible for, as well as this really fabulous energy efficiency workshop that was given by our partner, Gronlund, Washington, where he went over little tips and tricks you can use to improve the energy efficiency of your home, like caulking and making sure your doorway is sealed. I actually learned a lot from his workshop. But just to give you a sense of the homes of our participants, 54% reported that they had had water leaking inside their home at some point in the past 12 months. And then 48% also had inside water leaks, like pipes breaking or something. 30% reported signs of mice or rats in the past 12 months. And 14% reported having some mold that was at least the size of a piece of paper. In terms of energy poverty, which refers to an inability to manage your utility bills on top of your other household bills, 27% reported that they had received some sort of shut-off notice, not necessarily been shut off, but had received a threat of an impending shut-off from the gas or utility company, DTE Energy. And the same percentage reported using a cook stove to heat their apartment in the past 12 months. 22% reported reducing expenses for basic household necessities to pay an energy bill. So like I said, that's sometimes called energy poverty. And then just in terms of the baseline health of our participants, 28% reported that they had doctor diagnosed asthma. Next slide.
So one of the things are, well, we actually learned quite a few things from doing the Dcrew project. One of the things that was more telling, and this came from our case manager, is that, you know, in addition to needing assistance with their utilities, families needed help with either one or more of these things that sort of listed here. So healthcare, food assistance, you know, childcare, cash assistance, and so basically the utility assistance was sort of the tip of the iceberg. I think there was, from my understanding, there was not one household that just needed help with utilities. They had multiple needs, and we found out more about that when we actually went into the home. Right. So next slide, and back to you, Carina.
Yeah, so we did do the indoor temperature monitoring again on this study. And in this case, it was 34 households, but we had temperatures across a much wider span of the year. We replicated our previous findings, which were on a different group of participants, that about 65 to 70% of the homes had at some point temperatures above 82 degrees Fahrenheit at 5 a.m. These are 5 a.m. temperatures, by the way. We also had wintertime temperatures here, though, so we also saw that at 6 p.m. around dinner time, 32% of the homes had at some point in the year temperatures below 59 Fahrenheit. Next slide.
So this is some feedback that we got from the Dcrew participant and their experience. I'm just gonna just maybe direct you to the very last box that sort of talked about your experience with the case manager, both for visit to your home and any follow-up was beneficiary. And so 100% of the folks who participated in Dcrew said it was important to have a case manager that allowed them or helped them to enroll in some of the assistant program. So basically, based on that response, based on that result, one of the things that we sort of did for an upcoming project is look at making sure that we had case managers involved in the project. So that was one of the lessons that we learned and we took forward in terms of our upcoming projects, which I'm gonna spend a few minutes talking about if I have time. So back to you, Carina.
Next slide, please. Yeah, we also measured cognitive function and sleepiness at different points throughout the study. So the idea here was that there are a lot of aspects of indoor environmental quality, not just your thermal environment, but also lighting and noise and air pollution that can have pathways by which it affects your sort of short-term cognitive abilities. Okay, and so like you can probably relate to this if you're really hot or really cold or distracted by noise. It's harder to think straight. And so a lot of this research has been done in laboratory settings or office settings. There's a lot of interest in this in terms of what temperature to keep your office at to maximize the productivity of the workers. And then in community settings in people's homes, most of the research that's been done has been on college students. So we wanted to know what these associations would look like in an older population, not just young adults, and also low to middle income households. So 18 participants participated in these in 2 to 4 phone surveys, we called them, and asked them questions gauging their cognitive performance and their sleepiness. And we hypothesized that we would see this inverse V shape, so that, okay, so the y-axis here is delayed word recall score, and this is a 10-point scale in total. And the lower your score, the more challenging it is for you at that point in time to think. we did not see an inverse V shape. We did see a statistically significant improvement in cognitive functioning at those slightly warmer temperatures. And so we went back to the literature and decided that what might have happened here was it never got cold enough or hot enough in these participant homes. I should say that we only did the cognitive testing in summer, and they weren't particularly hot summer days. But it was interesting that even in this pilot study of only 18 participants, we were still able to see this, statistically significant improvement at these sort of mildly warm temperatures. Next slide. We also we saw statistically significant results for sleepiness. So this is this is backwards from the previous slide, and that the higher your sleepiness score, the worse that is, the sleepier you are. And we actually saw that you were less sleepy if your bedroom was mildly cool, which actually does make sense in terms of recommendations to have a cooler sleeping environment. And again, I think if we'd not done this in the summer, if we'd done this in the winter, we may have seen very different results in those homes where people's nighttime temperatures were getting down into the 40s. Next slide.
So earlier when we talked about the Dcrew project timeline, there was this weird little gray thingy on the timeline. And I talked about the fact that that sort of captured COVID, right? And so just in terms of some of the COVID modifications that we made during the course of the project, is that we decided not to repeat the stress questions because we just assumed that everyone would be under a lot of stress, and so it's going to be hard to distinguish the stress caused from COVID versus sort of everyday normal stress. Also, instead of doing sort of a in-person meeting, we decided to do follow-up survey on the phone. And then also we decided to have the participants mail back the devices, the iButton, the indoor temperature device, and I think for the hobos we just picked them up ourselves. But those are some of the modifications we made due to COVID. Okay, next slide.
Yeah, Zachary's team at Parkside was super helpful in getting the hobos back. They kind of went door to door to the participants and put them all in a mailer for us. So that was another benefit of CBVR, I think. So I just want to talk a little bit about some projects that we are gearing up right now. One of them is a new NSF, National Science Foundation funded project. It's part of their Smart and Connected Communities mechanism. And so the Dcrew project ended up serving as kind of a pilot for this, which also involves a sustainability case manager, but for a larger number of participants, and also incorporates some this smart technology component. Some of the homes will have e-gauges that will measure on a minute-to-minute basis how their energy is being used and in what part of the house. And that kind of information can be used to tailor recommendations for a participant about what utility or energy efficiency plans might work best for them, but also provide us some information about what fair rate structures might be, because as we move towards decarbonization and shift more of our energy usage towards electricity, we're going to see more and more a change in time of use rates. So if you're using electricity when lots of other people are using it, you're going to be charged a higher rate. And we also will incorporate neighborhood focus groups to get a better understanding of basic electricity needs. Next slide.
Yeah, so thank you. So basically, based on the results of the Dcrew project, some of the things that we're learning, we're going to be incorporating in a project that's also part of the project that Carina just talked about, but just in terms of how to use technology to enable residents to save on their utility bills. And so one of the things we're going to be using is, of course, the smart meters and other technology in Parkside. And so I would say, stay tuned. This is one of those things when I sort of said, where we don't know yet. So just stay tuned, and we're going to be doing an update probably in probably next year to talk more about our project in Parkside. Next slide.
Yeah, and that cognition and sleepiness data also served as pilot data for a now funded Weatherization and Health Effects Study. So this study was born out of conversations and insights from our community partners and also our government partners. Right now, funding for weatherization assistance. So this is federal funds, or in some cases funds from utilities, to tighten the envelope of your house so that you're using less energy. This funding is based on your utility savings over 10 years. And what we keep hearing over and over again is that there are probably health benefits to this too. And that should be factored into these calculations and should be considered when we're deciding how to fund weatherization assistance. So we're doing this actually in 3 cities, in Detroit, Memphis, and Milwaukee. And we hope to recruit 600 participants across those 3 cities. But we'll again be putting a indoor temperature and humidity monitor in each person's home. We will not be asking them to complete time activity diaries. We will be repeating the phone call type surveys, which worked pretty well. And then we will ask them to mail back the indoor temperature and humidity monitors after a year. We're also going to measure sleep a little bit more rigorously in collaboration with Dana Johnson at Emory University, who's an expert in measuring sleep. We will be asking participants to wear these red actigraphs, sort of like a Fitbit, but better. And they'll measure sleep quality for 7 days prior to the weatherization intervention, and then 7 days a year later. Next slide. So I'm going to wrap up things here, but I want to say thanks to many other people involved: Michelle Alford, Jabron Washington, Justin Schott and Brian Lewis, Michelle Lee, Raquel Garcia and her team at Southwest Detroit Environmental Vision, Guy Williams, and then many students and trainees on the project: Todd Ziegler and Chris Coombe, Kathleen Soul, Larissa Larson, Tony Reams, who is now at the Department of Energy, Veronica Barrick Hall, and of course the participants at the villages of Parkside, Jefferson Chalmers, and in Southwest Detroit. Next slide. And next slide. And I also want to acknowledge our funders: 2 internal sources of funding, Michigan Poverty Solutions and M-LEEaD, and then grants from the National Science Foundation, the National Institute for Environmental Health Sciences, and the National Institute for Occupational Safety and Health. And next slide. All right, there's a few of the many members of our team. And also I apologize if there's anyone I've left out on the thanks. There are probably many more people involved. But I think we'll open it up now for questions, Marie, or? Yeah.
Yes, thank you very much. Let's thank Carina and Zachary for their presentation. And yes, this is just a picture of Zachary and me and our student and staff colleagues on a wonderful summer day at Parkside, where I think we were having one of our recruitment or energy efficiency workshops. So remembrance of warmer weather. And I think we can close the slideshow. And I do want to just say that, I've known Zachary for many years as part of the Detroit URC, and it's been a great privilege to get to know him and some of the residents at Parkside who have hosted us for workshops and visiting, and it's a terrific group there with kids and families. So that's been one of the real benefits of this this project, is getting to know the folks at Parkside. And I see that there's a question from an anonymous questioner who asks, will you be working in other neighborhoods in Detroit? And I'll let either Zachary or Carina answer that.
Yeah, for the weatherization and health effects study, the answer to that is yes. EcoWorks is citywide in terms of the services that they offer. And anyone who is about to receive services from EcoWorks, whether it be attending an energy efficiency workshop or appliance replacements, or any of the other services they provide, would be eligible to participate in the weatherization and health effects study.
Yeah, and I'll also mention that the new Smart and Connected Community Studies involves folks from, did you say this already, from Southwest Detroit as well as the Jefferson Chalmers area. So we do have a reach across other neighborhoods. Rebecca has a question and asks, in terms of home weatherization and health, I'm curious if weatherization influences indoor air quality in addition to temperature. Is this something that you'll look at?
Yes, it does. And this is something that others have certainly looked at. When you tighten up the building envelope, you potentially increase indoor levels of indoor air pollutants because they're not seeping out of your house anymore. It's sort of in the full-blown weatherization where there's air sealing and insulation added to the home and maybe HVAC upgrades, it is good practice to put in a whole house fan that exchanges air outside to inside without losing the heat or the cold that you're trying to keep into the house. Those in practice, I'm not sure it always works as well as people would like it to. And then I think in some homes it's not installed, or it's not installed up to standards. So I think it is an important consideration in this. We are looking for money to actually measure this in our study participants in terms of measuring indoor PM2.5 and carbon dioxide. One of the challenges is that many of our participants do not have reliable Wi-Fi, and the cost of the data logger to record that data is considerable.
Thank you, Carina. I see that Toby Lewis has also asked a question, and I'm thinking Zachary may be a good one to start on this. I'm remembering the interview process we went through. So Toby says, I'm curious about the case manager. Did they manage study activities, data collection, as well as connecting families to services? What were the key qualifications for the person in that position, professional or personal?
So as usual, Toby has some great questions. So hi, Toby. So I would say I'm gonna start with sort of the last question first. Just because one of the things that was important for me, especially since the case manager is going to be housed at Friends of Parkside and going to be working with public housing residents, I really wanted someone who had some experience working with this community and the folks from this community. And so so we were fortunate enough I was fortunate enough to know Michelle Afford, who used to be the on-site property manager here at Parkside. She was here temporarily because the other manager went on maternity leave. And so she did such a great job. And I was getting all kinds of, positive reports from residents about her, how friendly and how helpful she was. And so it was a no-brainer for me to sort of reach out to her about this particular position because of her background and her experience working with residents. I just thought she would be great, and I was right. It's rare when we were right about something, but I was definitely right. Just in terms of coordinating the follow-up with folks in the study, she sort of did that, and she was a member of the research team for the most part, just in terms of knowing what was needed, when it was needed, also bringing feedback to us to sort of say, hey, these are the problems that I'm running into. I think all of that helped, you know, because she was not sort of off to the side, but she was a regular contributor of on the team. So yeah. So hopefully that answered your question. If not, just please, you know, ask again.
Thank you, Zachary. And I'm realizing we're at 12:51, so we will need to close the webinar, but I want to thank you and Carina again for sharing about the project, and thank M-LEEaD for sponsoring us, and Meredith and Robin for setting this up. So have a great afternoon, everyone, and take care. Bye-bye.